Hello, I'm Norbert Gleicher, MD, and I'm the Medical Director and Chief Scientist here at the Center for Human Reproduction. You may not recognize me in this outfit, not only because I'm in scrubs, but of course because of the other paraphernalia. But as you all know, we are in the midst of a worldwide viral epidemic, and this is how CHR looks in these days. We are pleased to be able to continue serving our patient population, but obviously it has to be done in very, very different ways from how it used to be done. And what you see here is just one of the reflections. We obviously have a uniform mask wearing requirement in our facilities and many, many other changes. The important thing, however, is that we are so far able to continue providing services completely uninterrupted. And this is really the topic that I want to talk to you about. What to do at a time like this when you're an active fertility patient. What you are encountering in many parts of this country and all over the world is that you suddenly have nobody to offer you those services. Many IVF centers have closed for a variety of reasons, and we will be talking about this in a very separate video. But fact of the matter is that with the closing down of many cities, many IVF centers, probably a majority of IVF centers, found themselves in a position that mandated that they close their doors. And that has left a lot of patients stranded. What to do if you're one of those stranded patients? You can obviously look in your neighborhood for IVF centers that still do provide services, but it is difficult and not necessarily recommendable to switch in the middle of treatment. It's possible, and if you really feel that your circumstances require it, that your circumstances are so urgent that they require it, then this is obviously a good option. But quite a good number of patients also travel for their services, for their infertility services. Here at CHR, a very large portion of our patients come to us from long distances, many from overseas, many from Canada. Travel is difficult. Travel now carries certain risks. And therefore, it is not necessarily something that we would automatically recommend. So what can you do in the meanwhile? And here are our suggestions from CHR. Nobody can tell you with absolute certainty how long this craziness will take. But as we are hearing from our president, there's already talk about winding some of the closures down. My own personal feeling is that New York may be at the very end of the time sequence for that to happen, because we are such a hot spot of viral activity, at least at the present time. But one can anticipate that within a few weeks, hopefully after Easter, and at least certain parts of this country will find their restrictions to be limited. And as a consequence, it is my full expectation that some colleagues will reopen their centers. Until then, you can do a few things. You can get yourself into best possible shape. And I don't have to tell you what that means. eat well. There are now studies that show that if you eat a Mediterranean diet, in other words, a healthy diet, fertility outcomes are better. How much of a difference it makes? Some. It is obviously not the principal cause of why you suddenly will be getting pregnant. But it is something that you may do to slightly increase your chances. So try to eat healthy, try to exercise, try to get a lot of sleep. Sleep strengthens your immune system, sleep helps in your general health. And take supplements that you feel, or even better, your physicians feel, may help you in improving your outcomes once you do get back into active treatment with your fertility center. As you know, here at CHR, we have kind of a mixed approach to the concept of supplements. We are not in support of those long lists of supplement that some fertility centers simply give to everybody. But we do believe in selective use of supplements. We think that you should make sure that your vitamin D levels are good. We think that you should be on a prenatal vitamin. If you are on a good prenatal vitamin, you do not need any other vitamins on the side unless you have a very definite deficiency. We support, especially in older women and in men who have a problem with their sperm, supplementation with CoQ10, an antioxidant. And as many of you probably know, and I must here remind you that we have some commercial potential conflicts in addressing this issue, because we here at CHR basically brought DHEA or androgen hormones into infertility treatment worldwide. We are holding certain patents on this, and we receive certain royalties from some companies that produce androgens, such as DHEA. So please keep that in mind when listening to what I'm saying. But what I'm trying to say is that we feel that androgen supplementation can help you greatly if you have low androgens. And it may be difficult right now in this situation to get you tested out, but if you're over age 40, you can assume to have low androgens. And if you were diagnosed with low ovarian reserve, even at younger ages than 40, you can practically also assume to have low androgens. There's no reason not to start DHEA if you fall into those groups who with overwhelming likelihood need DHEA supplementation, because it takes 6 to 8 weeks before your levels are appropriate so that you can start an IVF cycle. So use this time until everything returns to normal to get your levels up. Nothing wrong with that. If you have any further questions, we are of course here at CHR. We can be reached at 212-994-4400. Should you have any questions, you can also address them through our website by email. You will always have an answer. So with this, I can only wish you good health. Watch out, be careful, wear your masks, and I hope all of this will be over soon. Thanks for listening.